Hello, everyone. And I will just set up a couple of things and we are ready to go. And we seem to be, again, having a little bit of technical difficulties. Not sure why this is. We are live. Seems we are live. Let me know if I am actually broadcasting. Some reason it is working on Instagram. And let me know, you guys, on Facebook. And also let me know on my website. And we will make sure we get it all straight and forward. So welcome to our weekly session. It's great to see all of you. And we will begin. We do our 3-part process just as we teach in our workshops. We've got a workshop coming up in a couple of weeks for anybody that's interested. And Faris, we will start with you. And blood flow to the brain. Brain command points. So let me know how you're doing, better, worse, or the same. Rachel 3280, welcome. Let me know how your mom's doing. And let's also check to see if we have anybody on Facebook. Not yet. Hopefully it is connected, but I don't think it is. I am live. So let me just take a quick here. And we want to make sure we don't miss anyone. Okay, seems like one of the channels is not working. It is. Which one is it? Tongren Station. Okay. And I don't know why Instagram is giving us our time. So this is as good as it gets. This is what we're going to be working on. And let's begin with Faris. Let's go to the brain. Tap for your mom. So in about a week or so, we'll be launching. Thank you. We'll be launching the community in a couple of main parts. Each month we will have a training session, system by system, to go over advanced topics. We will also once a month be having a Q&A session. That's for me to get questions from you and also for you to share the different things that you want. So the command points of the brain, command points of the brain stem. So our 3-part process. Long-standing cough. Cardamom. Elderberry. Colloidal silver spray, gargled. But let's work C3, 4, and 5. which includes the eyes and the throat. And depression, GB13, right side. Microbiome. Happy hormones, serotonin, migrating from the gut. So again, for the eyes, facial artery for the eyes, ouch point for the eyes. And also the kidneys for the eyes, the liver for the eyes, rather. And grounding to liver 3 and kidney 1. A little more ouch point for the eyes. Please help her. Herbs. As well for the eyes, eye drops. But let's add some extra stuff for the lungs. Lung 1, lung 2. The lung meridian. So let's work for happy mama, chi for perfect blood flow to the brain. 9 points. Yeah, if people are interested, in a week from Saturday, we have our Tongren workshop. Let me know if you're interested. Blood flow, nerve flow. So perfect blood, bones, bone marrow, T1. Strong immune system, T1 to T8 also. Seems nobody is on Facebook, or Facebook is not working for us. We are not on Tongren Station. Sure, it seems. Let's continue. Oh, let me check one other outlet. See if anyone has jumped in by text, but we can still include them. Anyway, T1 to T8 from Omashari. T7 to T12 also for the immune system. And there we go. So how's everybody doing? Enjoying this nice cold weather if you're from where I come from. And grounding at GB13 right side for Laura. Word for your mind, balanced hormones. GB20 and 22. Much abundance in Tong, connecting to the abundance of your own consciousness, true self. That is true abundance, what lies within. Okay. So Les, good to hear from you. And Tracy, hi. I just take a quick screenshot here. Good to see you. Okay, continue on. Les, did you check in about two feathers? Let me know. So blood flow to the brain. Cancer is a condition of hypoxia, oftentimes exacerbated by toxicity or deficiency, resulting in inflammation. Command points of the brain, command points of the brain stem. So let's focus. Systemic oxygen and cancer would be the phrenic nerve, lung 1, lung 2. Let's focus on specific areas, C2 to C7. T2 to T7. And L2, 3, and 4. And T6, diaphragm for oxygen capacity, which is anti-cancer. And looks like Instagram has gone instantly grammed away. Oh, we're still there. Good. Not sure why you would do that, but he did. Okay. And CB4 for less. Charge that battery. And see my newcomer, cervical disc, C6, C7, C3, 4, 5. So let's do 4, 5, 6, and 7 for you. Lower back, hip, neck, and right arm. Let's go to the brain. Brain command points, brain stem command points. So can your mom take any herbal remedies or any liquid remedies, tinctures or anything? Methylene blue is an option. Fenbendazole is another option. They call it mebendazole. If there is nothing left they can do, they may consider doing a dose 222 liquids in a dropper. Methylene blue makes everything blue. You got to watch out. Methylene blue. And C3, 4, 4, 5, 6, and 7. Methylene blue diluted. For less. Lumbar 1, 2, 3. Hip, neck, and right arm. So let's do the brachial plexus for the arms and neck. Lumbosacral plexus for the hip and lower back. Emotions, GB13. So for Rachel, let's all maybe add some praying hands in the Instagram area. Maybe we can do that. And as well as on the website, they say her mom only has a few days to live. For Rachel. CB13 right side for there's a good brand of methylene blue from globalhealing.com. globalhealing.com. The doctors will know what it is, they just don't use it. But of course, always inform the doctors of what you're doing. Right side arm pain, let's do the out points as well for timid newcomer. And then grounding to liver 3 and kidney 1. For Helen, let's work with Helen right now. And for as a message from Rachel on social media, please tap for peace and justice in the US and globally. We are one, which is exactly right. Tracy, how you doing? Let's do it. Blood flow to the brain. Hidden tongue, third eye area. Command points of the brain. Okay, let's just continue on. All right, let's make sure we don't miss it. Yes, we hear you. Les, thank you for checking in. I appreciate it. On. Yes, it's working. Thank you very much, guys. Keep doing that. Miracles do happen. Yes, remember what she is saying. So let's continue. Command points of the brain. Create collected creation and extra work for Mumashari. Craniosacral fluid. For the bones, bone marrow, blood health. GB13 right side. Fatigue, always check your iron and your copper levels in your body. Blood flow, nerve flow to the spine, and then also for gentle chatter. Digestive distress. Depending upon the type, a good way to start that is digestive enzymes, proteolytic enzymes, and also aloe vera juice. Headaches. GB20 is the classic point. Right at the base of the skull, you'll feel it right there. See if you can see my ears. It's about 4 o'clock from the ear, using the ear as a clock. Four, 4:30. T1 to T8 immune boost. Do an immune boost for Ellen as well. So 2 parts to an immune boost, T cells, B cells, and the microbiome, which and SIBO as well. 7 to T12 for Helen, and also for gentle chatter. And grounding to liver 3 and kidney 1. Gentle chatter, you're doing good. That's great. And let's check our Facebook friends. And let's do a specific tapping for world peace at the end each time. In addition to that, we should always focus on that. Okay, there we are. Lost my bearings for a second. Welcome. Hello, everyone. Blood flow to the brain. So we work on endometrial, peritoneal, liver cancer with ascites, postnasal drip, small airway disease. Blood flow to the brain, brain command points, brain stem command points. And we're also working for cool habitant, loop for several severe dry eyes, severely sensitive to indoor and outdoor lights. So in terms of indoor and outdoor lights, you need to block the blue light. The blue light is the serious one. I have different types of glasses for different conditions, and you need blue light blockers because those are the harmful lights. Outdoor lights, indoor lights, too much blue light. You can watch the sunrise sunlight. That's a different thing. If you watch that, that will start to recalibrate your eyes to watch the light properly. But all devices, light bulbs, there are special light bulbs you can get too from companies like Blue Light or Chromolux. I have blue lights blocking. Basically, they are full spectrum natural light bulbs. And usually I have my things on, not for this workshop. I mean, not for this event, but eventually I will. But I have special glasses. And let me just check. Seems we have a visitor. And since I'm the only one that lives here, that wouldn't make sense. So let's get focused. Endometrial cancer, L1 to 5, peritoneal, endometrium area, peritoneal area, and liver, T9, 10, 11, 12. lumbar 1 to 5. Lumbar 1 to 5. Postnasal drip, C3, 4, and 5. Small airway disease, fatigue, of course, because you have less oxygen. Consider, depending upon the cause, but consider expanding the capacity of your lungs by using these devices, as I did to reverse, there it is, to reverse asthma. That's one idea. But let's work on the lung 1, lung 2, and CV17. I would start with put 2 or 3 drops in water. Rachel is asking me how much do I dilute the methylene blue. It's really blue. Like I say, talk to your doctors before you do it, but all it does is increase oxygen, period. It was developed about 150 years ago. I would start with 2 or 3 drops in some nice water. Lung 1, lung 2 for the lungs. But for Luke, so ascites, T1 to T8, hypothalamus, pituitary. T3 for the lungs, lung 1, lung 2, and CV17. Increase oxygen, increase energy, reduce fatigue. So let's work for Luke. Dry eyes. Constant itch ear canal. So the vestibular cochlear nerves, GB789. Brain fog. A 2-part process for brain fog is electrolytes, believe it or not, because that will create your body charge. There are a couple of recommendations I have. One is beam minerals. The other one is cantonic minerals. One works for the blood, electrolytes and charging, and the other one works for the internal cell for the charging. But beam specifically says it's good for brain fog. In tongue, third eye, and hypothalamus for eye sensitivities. Cognitive function loss, GP13 and C3, 4, and 5. Blood supplies to the brain for Augustina, carotid artery, vertebral artery, occipital artery. Nighttime frequent urination, GB13. If you can get with an acupuncturist, get to put a magnet on spleen 6. So let's us focus on it, spleen 6. Frequent urination, the prostate is related, so L1, 2, and 3. There are specific herbal remedies I used myself with an elevated PSA years ago. T1 to T8, systemic inflammation. Also chronic fatigue. Check your iron and your copper levels. So when you say chest pain, let's have a little bit more information on that. If you feel you're having chest pain like a heart attack, of course, call the doctor right away. Plantar fasciitis, there are chiropractic remedies for that. And the knees, blood flow, nerve flow. Her teeth may turn blue if you have a higher dose. So add it in some water like I used to do for my mom. I use methylene blue for my mom. So prostate L3 and CV4. Arthritis, stomach 36. Ouch point for the knees. Plantar fasciitis, kidney 1. You're welcome, cool habitant. And let's check on our Facebook friends. Dell, there you are. Lower back and hip pain. With your schedule, must be even hard to walk. So let's work for world peace first. Tong and then Dell. Tong, third eye area. World peace. Tong, third eye, awakening consciousness. GB13, reducing anxiety. CB17, the heart of compassion. Lower back and hip pain. Where in the lower back, Dell? So let's do T7 blood flow, nerve flow to the lower back. Lumbosacral plexus. Let's go after the whole back. So hip to hip, lumbosacral plexus for Dell as well. and grounding to liver 3 and kidney 1. We are one. So let's go back. So, Confident Trailblazer, Hashimoto's. Yep, you're attending the workshop on 118. That's great. Cohabitant. Okay. Okay. And we have, again, endometrial peritoneal liver cancer with ascites. Is that the same as the other one, or is it a new... No, it's the same. Grateful individual. We'll work on that some more. B mineral, I saw specific people asking me about the minerals, the electrolytes. So Luke started the B minerals. I saw specifically on their website, even just today, that how it helps brain fog. But I recommend a full process. They do have a men's beginner where it includes some other things. Let me know which ones you got, because fulvic and humic acids are good for the cellular electrolyte terrain. The B minerals are good for the, as they call it, the oceans of the body for the electrolytes. So if you do those two parts, the other one is called Quintonic, Quintonic. So he wakes up due to chest pain. Okay. Is it a sleep apnea or is it a different thing? Dal, welcome on Instagram. You're probably on a bus or a train, if I know you. So let's continue. Hashimoto's, neuropathy, confident trailblazer, Hashimoto's, aging syndrome. Welcome to the club. Let's work on that for everyone. An anti-aging tea, after looking at a lot of things, would be astragalus, ashwagandha, and cat's claw. Those are common elements in many recommendations. C6, C7, Hashimoto, so pituitary, and then thyroid and parathyroid. So if you have Hashimoto's, you need to stop drinking water with fluoride, stop eating white bread, because those foods interfere with the receptors in your thyroid and parathyroid. AGE syndrome, GB13, less stress, longer life. C6, C7, Hashimoto's tune-up. Neuropathy, vitamin B12 and alpha lipoic acid. T1 to T8 for the shingles. It's an Epstein-Barr virus, dormant virus, sometimes from when we were young. And neuropathy left arm, so brachial plexus down to the left arm. Okay. So, kind legend, where is the fibroid? One of the superpowers for fibroids is Castrol Pax. That's one of the things it does really well. or you guys can even check out this book, Free Your Body of Tumors and Cysts, by Anna Kroger. In many ways, she's a lot like O'Neill, but Kroger from about 100 years ago. For IBS, it's glutamine, contraindicated if you have any history or currency of cancer. Joints for arthritis, high dose vitamin C, and then high dose turmeric with black pepper, organic and fermented. Those are the best ones I can find. Something close to that is also good. So where is the fibroid? T1 to T8, kind legend. We'll do inflammation in general. Good to see you, Dell. Good to talk to you the other day. Glucosamine is something different, also used for the joints. IBS is glutamine, joints is glucosamine. Hernia, where is the hernia? We're presuming it's an inguinal hernia, but we will use lumbosacral plexus. So that two-part process for electrolytes is good for everyone. He wakes up due to chest pain. Make a note of the time. It may be the same time every day, every night. That equates to specific organs that you can basically analyze. It's important to know about his chest pain. He should focus on all pain, especially if it is consistent and repetitive and it comes back. He has heart palpitations at time, and there's the herbal remedy from the company Herbal. It looks like this for heart palpitations. This is actually an herbal remedy for that. This company, if you could take a screenshot and then expand this, because the writing is, I don't even think ants can read this writing. It's so small. But this company, this is AFib. There are also ones for tachycardia and palpitations, I think, as well. Cannot see the bottle. Let's take a look here, StreamYard. The brand is at the top there. But look around for this picture. Look for heart health, multiple products. This says on the top, something herbal. I forget what that is, something herbal. Let me know if you can find it. If not, email me and I can send you a link. CV17 for heart pain, T1 to T8. And I did not see the rickets, but I'm glad you reminded me, the rickets, and we will repeat. I don't see the rickets. We hear you. Nope, I don't see rickets here. First time they show up on the chat. Unless I missed it. Let's see. Okay, so we got the rickets. Rickets is bone absorption. Fluoride breaks the bonds of calcium. Fluoride negatively impacts the receptors for calcium, for fluoride in the thyroid. All these things manage bone. So let's work on T1 to T8, as well as growth hormone, GV20. It's located in the uterus. What is that? The hernia? No. I'm sorry. Kind legend. We're just making sure. Fibroid. Okay. Gastro packs on below the belly button. Ideally with a type with essential oils like frankincense or oregano. That will help a lot. You can put it on the lower back on C3, LL3, and put it on the lower belly, below the belly button, on the abdomen. There are specific wraps and packs for that from a company. There's shoparandi.com. If you email me, I'll send you a link, and I get discounts for everyone so I can pass it on. So rickets, T1 for the bones. And again for Mumashari for the craniosacral fluid, good for the bones and bone marrow. The crystal palace to T1. For the rickets, also GB39 special point. The two-part process of electrolytes that I'm mentioning. Number one is it's called BEAM, B-E-A-M. They have different products. Take a look at them all. That is for more of the blood flow in the oceans, as they call it. The internal one is for Kintonic, which is got fulvic and humic acid, which is really good electrolytes for the cell itself. These can be game changers for some people. But Edgar Casey has specific cases for you, kind legend. But let's work on it. L1, 2, 3, S1 to 4. First product is BEAM, B-E-A-M, Bravo, Echo, Alpha, Michael. The second one is Kintonic, Q-U-I-N-T-O-N-I-C, Q-U-I-N-T-O-N-I-C. You can start with, they have a woman's and men's bundle. You can start with that because that does have some fulvic and humic acid, but I would suggest that two-part process. That was recommended to me by a brilliant practitioner. So for nighttime issues, make sure Luke is sleeping in total darkness. I sleep with an eye mask. There are even eye masks with EMF resistance. And last night, I hadn't used it in a while. And last night I used it. I really changed my sleep. I do two things for sleep. One is an earthing mat. Number two is an eye patch of my eyes. Lights out. Night shift. Body must understand. That's night shift. That will help you. If there is any sleep apnea, there's also a cure for that as well. So what I'd like to do as a tradition going forward, and if I forget, please remind me, we will always end the session tapping and praying for world peace. That is now a part of every single time that I work. So let's work on his heart palpitations, TV 20, 22. I had them before myself. Celery juice is another good option for Luke as well. T1 to T8 for detox from mold and smoke. Clay detox, high fiber foods, NAC for lung cleansing. Deep despair, TV 19th, right side. And T9, right side as well for liver health. The gut microbiome for deep despair, CV4. You need to clean your lungs. NAC for the lungs, antioxidants for the lungs. Otherwise, nebulizers or inhaling. Sunny Gem. And we'll do one extra round. Somebody asked twice, and we will do it. Blood flow to the brain. Brain command points. Endometrial, peritoneal, liver cancer. I would do liver castor oil packs right away. Postnasal drip. That is a sign of systemic infection. Nasal-oriented. Small airway disease. Lung 1, lung 2, phrenic nerve, and CV17. CV4 for the large fibroid. Okay, so let's go back to our You're welcome, Del. It's awesome to see you. You make things, our community benefits from your presence as well. So let's do one more round for everyone. Blood flow to the brain. Command points of the brain, command points of the brain stem. The eyes for Catherine. And the liver for the eyes. T9 for everyone. Varus' mom. And grounding, liver 3, and pain for Esther. And grounding to liver 3 and kidney 1 for everyone. What is the cure for sleep apnea? Mouth tape at night. Sleep apnea is the problem that a lot of us have. Breathing through the nose is better than breathing through the mouth. If we breathe through the mouth while we're asleep, we can choke, we can have a blockage of the airways. Always consult your doctor first for these types of recommendations, but one method is sleep tape over the mouth at night, forcing nasal breathing, bypassing all the inefficient breathing of the throat, and then breathing through the nose can rectify that. It's a thing. It's been around for a long time, especially in Europe. But always consult your doctor if there is sleep apnea. Sleep tape is a thing. If you email me, I'll send you more information on that. Grounding to liver 3 and kidney 1. Okay, so let's do Qigong for everyone. Sit with your feet flat on the floor, palms face up. Breathe in through the dantian area, the lower area just above the belly button. Breathe in and out through the nose as always. If you can, breathe longer through the nose. On the exhale, that's what I meant. And let me know if you're interested in joining the workshop. There's still time to join, time to get the supplies. And focus on the uterus, which could be a blockage as well. Cayenne pepper, another option. Okay. Cure for asthma, sleep tape for sleep apnea, tailbone adjustment for curing leukemia. Tongren works on all of those things. Disease prevention, victory over cancer. Hopefully it's not reversed. Many choices, everyone. As always, we attribute this session to reducing suffering for all humanity and hoping for world peace as soon as possible. And especially for our community, hoping for a better day every day. And special shout out for Helen, Rachel's mom. To get through this, pray for her, give her the strength to turn this around. Thanks very much, everyone. Have a great day. We did include Esther and Catherine automatically as much as possible. And we will talk to you soon. Blessings to all of you. Keep in touch. We're building our community as well, which starts in a week or two where everybody will be together. We will have special trainings every month, every other week. We'll have special Q&As so I can support you more directly. That's what we do for all of our people. See, Shelley Travel, what a great name. See, Shelley Travel, that is the best name ever. Welcome to our session. It's just ending now, but thank you for joining. This is Chi for everyone. Debbie, I said Helen, but Debbie is your mom. So let's pray for everyone, for Debbie, for your mom. Must have been a different person, but it's Rachel's mom. Give her some extra chi from all of us. And thank you to all of you. Have a great day and see you next week. If not sooner, keep in touch. My job is to give you every piece of information and support to reduce suffering, period.